say something?
Hello?
Yeah, just hit me. I had it, all this stuff got messed up from yesterday's thing. Alright. 1 second. And
All right, we apologize for the technical difficulty. We will try that one more time. Welcome to the weekly update from the Department of Behavioral Health. We're making some minor technical adjustments for the sound, which might be a little low right now, but Brian is working on it. We had a press event yesterday, and so we're trying to get back to normal. All right, onward to our report. We now have 225,782,099 cases across the world. We've just went over 4.6 million deaths. You can see on the right-hand side that worldwide, it seems like we might be coming down from the surge overall. Although just like our national numbers, there are parts of the world that are still experiencing a surge. In the United States, we're now almost at 40.5 million cases, 653,058 deaths, and our surge is still going up a little bit. In California, we're coming down. We're now at a 4.5% positivity rate. Last week we were at 4.9, so we've come down a little bit. You'll see in some other numbers, while our cases go down, we still have some hospitalizations and our deaths are starting to go up. In Fresno County, 120,644 cases. That is 42.9 cases per 100,000. Remember that. I'm going to bring that up again in a minute. We've had 1,831 deaths. So in the last week, we've added 31 deaths. I don't know if you'll recall, and if you look at the graph on the right-hand side, we were experiencing very few deaths for several weeks, and now we've started trending up again. For youth, we've added about 2,000 cases in the last week, going from 21,000 to about 23,000 cases. In terms of hospitalizations, we are just hovering there between 395 and 408. Over the last several days, it just keeps going up and down. So if you look to the right-hand side, it's been a few weeks that we've been close to 400. Sometimes we go over for a day or two. And then come back down. Last week we were at 392. But of concern is we only have 8 ICU beds. The other thing to note is this last week, 89 in the ICU with a total hospitalization of 395. And that's our highest in the ICU over the last few weeks. So we've been at 395, 392, but with a few less people in the ICU previously. And I'll talk about that in a minute as well. In terms of kids in the hospital, and remember this graph is for Fresno and Madera County, you'll see on the right-hand side we're still, trending more up than we've been at any other part of the pandemic, both in terms of hospitalizations as well as kids in the ICU. At this point, and I'm not going to talk about this a lot today, at this point it's pretty clear that the Delta variant is more infectious, not necessarily clear that it's more lethal or causes more severe illness. That is something we'll find as time goes on. But we are seeing more kids impacted. Is that because school started and most kids are back in school? Or is it just a function of the higher infectiousness of the Delta variant? Again, something we'll be watching closely. In terms of our testing trends, we're down to 9%, under 10. Last week we were at about 9.9. So it's good to be under 10, but remember we want to be under 1, so we're way too high still. Still seeing positive cases. For vaccinations, we're now 1,047,110 doses given. That's 452,713 who are fully vaccinated and another almost 90,000 who are partially, so they're waiting for their second dose. I can't wait for that fully vaccinated to get over 500,000. We have increased by 18,000 doses in the last 7 days, so that's real positive for us. For youth, we now have 38,713 with at least one dose, and 30,368 who are fully vaccinated. So that number continues to go up. We've added about 2,000, a little over 2,000 kids being fully vaccinated just in the last week, so that's great. We're up to 63.3% of residents over the age of 12 who are at least partially vaccinated. That's a small increase of 1.1%. We were at 62.2%. And individuals over 65 is creeping on up still, 87.9%, which is really good news. So otherwise, what's happening in Fresno County? Our cases are leveling off, but they do remain really high. 42 per 100,000 is way higher than what we need it to be. Hospitalized, not going up, not going down, stabilizing at about 395 over 400. Deaths are increasing again. Our positivity rate has decreased slightly, but still double the national average. So we're at about 9%, and the California average. The California average is about 4.5%. So we're still double that California average, and we remain in the purple tier along with most of our Central Valley counties. You can see here on this graph, this shows our cases. Our case rate per 100,000, and so remember we lagged the state. We got higher than the state in the case rate, but the state started coming down before we did. So you can see that slight decline that appears to be happening, which is good news. This slide just shows our tier, and you can see that predominantly purple tier. The only county that has a little lower test positivity is Madera County, and it's still pretty high, over 7%. So across California, new COVID cases do continue to decline. Hospitalizations are decreasing overall, but deaths are increasing. That's that lag we always talk about. And then really of note, our San Joaquin Valley is the first region in the state throughout the entire pandemic to trigger what they call hospital surge protocols. And these are protocols that we've talked about in the past but haven't had to implement. And that is where you kind of choose who's prioritized to get a limited resource. It's an uncomfortable thing to talk about because it's an ethical and moral dilemma when caregivers are faced with having to choose if there's a limited number of, let's say, a ventilator, and I don't think we have limited vents, but an ICU bed. Who gets that ICU bed? Probably the piece of equipment that's the most in demand right now with the least supply is what's called an ECMO machine. And an ECMO machine is like a highest level of cleansing your blood, and there's not very many of them, and it's really labor intensive to run an ECMO machine for someone, and it's kind of a last chance thing to do. And so there are more people who need an ECMO machine than we have ECMO machines available both in Central California as well as across the nation. And so hospitals have to put these protocols in place. So it's not an individual subjective decision, but there are different mechanisms, different criteria that go into place for them to decide who actually gets a limited resource. Not a good position to be in. And so during the first 3 days of September, what really triggered these surge protocols is that our region had less than 10% staffed ICU beds available. So that means of all the ICU beds we had in our region, fewer than 10% of them were available. And you could see for ours, 8 beds across Fresno County, not very many beds given we have a population of 1 million people. And just as a reminder that these aren't just limits on care for people with COVID. These are limits on care for anyone. If you have a heart attack, if you're in a car accident, if you have a complication when you're pregnant, all of those get factored in terms of if there's a limited resource available. All right. Nationally, our cases are generally trending down, but there are still areas with surges. President Biden has announced that he's going to require the vast majority of federal workers to get vaccinated, and he's asking OSHA to mandate vaccines at businesses that have 100 or more employees. That's not final yet, but that is a request that has been made. And this slide, which is very, very busy, but I'm going to highlight some things for you. This just shows state by state, and all the states are on the website. I just listed the top 10, and then I tried to include California, because we're not in the top 10. That's a great thing. One of the things you don't want to be in the top 10 for is cases of COVID. So in this one in particular, you're looking at cases, the daily average cases per 100,000. Whether or not that's increasing or decreasing for that state, hospitalizations per 100,000, and deaths, a daily average of deaths and per 100,000. So Tennessee, for instance, is at the very top. They're having 101 cases per 100,000. So our 40 some odd in Fresno County is less than half of Tennessee, which is one of our highest states. And they've seen an increase, so they're still peaking. And then they have 48 per 100,000 hospitalized with COVID. And then you go down, South Carolina, Guam, Kentucky, West Virginia, Alaska, Wyoming, Alabama, Mississippi, and Florida are all in the top 10 for cases per 100,000. And then California overall, even though we have a lot of cases, say a lot more than Alaska has 608 and we have 10,559 on average, we only have 27 per 100,000. And so compared to that top one of 101, we're significantly lower. And our hospitalization is 21 per day, so lower than the 48 that you're seeing in Tennessee. And so these are the kind of things that we're looking at when we're looking at hotspots across the United States. And then in terms of daily average COVID hospital admissions, this kind of shows you across the United States from August 1st to September 6th, who is representing the individuals hospitalized. So we're still experiencing more people 70 and over and even 60 and over as the highest representation. But we're also seeing that under 18 go up, as I mentioned. And then in particular for hospital admissions for children, on the left-hand side, you see hospital admissions in the 10 states with the highest vaccinations compared to hospitalizations with the 10 states with the lowest rates of vaccination. And so for the ones with the highest, the top line, or highest rates of vaccination on the left, the top line is adults and the bottom line is under 18. So where you have high rates of vaccination, you do see a peak of adults, but it stays pretty flat for under 18. And where you have low, you see both going up. Adults far more than children, but definitely kids are going up too. And although California has relatively high rates of vaccination, remember in Fresno County we have lower. We look more like a lower vaccinated area. All right, so what else is happening in our neck of the woods? I did want to remind everyone what we're required to report as an employer by Cal OSHA, and OSHA stands for the Office of Safety and Health Administration or something like that. I made that up, but I think it's something like that. Occupational safety and yeah. And so we're required by state law to report positive cases in the workplace. So when someone in the workplace gets COVID and we are notified of that, we notify any staff who work in the area where that person worked. So I'll just use Hawk as an example. If it was on the second floor, we notify everybody on the second floor. If it's on the first floor, we notify everyone on the first floor. And then we notify public health if we have more than 3 cases in a 14-day period or 20 or more cases within a 30-day period in one location. So for instance, you know how we're doing our testing with our department? That would have to be in one building. Now, because of this, because of how we are doing the testing in our buildings, it's putting us at risk of having to report, because even though the people getting tested may not work in our building, they may not even work for our department, those positive cases trigger these warnings. So starting next week, we're going to move all of our test locations outdoors. And we'll be giving you advice on things like if the temperature's high, you can sit in your car to wait for the test results, that type of thing. We're making the locations convenient so you can stay safe and cool, etc. And we'll have a system in place where we can keep everybody's place in line and that type of thing. Pinnacle's been doing this a long time, so they're really going to work with us to make sure that we create a good environment for that testing to occur. But we are moving it outside so that we don't trigger those notifications for workplace COVID positive when it's not actually someone working in the workplace who's necessarily COVID positive. All right, what else is happening in our neck of the woods? We have September, which is Suicide Prevention and Recovery Month. We did have a press conference yesterday where we talked about some of the newer things that we're doing, including some items that the board approved this week. One is a follow-up call to individuals who've called our Suicide Lifeline. And some things like that we highlighted in the press conference. And then we also have this nifty graphic with the flower and the snail. Hopefully you've seen the video of that. I'm not sure if Brian's shown it on our YouTube, but we'll make sure we get that sent out to everyone. And then we're having people sign that with messages of hope. And the theme for this year is reconnect, recenter, and rebuild. And you know, the last year and a half in particular, we've really become divided and disconnected. Disconnected because of COVID and all of the restrictions. We're all behind a mask. We have to keep 6 feet from one another. There's a lot of fear and anxiety about that. We haven't been able to see our loved ones and friends as often. And so it's really important that we reconnect. We've also experienced a lot of political divisiveness and divisiveness around differences in ideology and beliefs and all kinds of things related to COVID and politics and religion and race. And all of those things serve to divide and disconnect us. And when we're divided and disconnected as a society, it's really a fertile ground for hopelessness. It's really a fertile ground for depression and anxiety and fear. And so if we can set aside and really work to reconnect in safe ways, pick up the phone, write a letter, meet someone in an outdoor setting, it's really important for everyone to reconnect, not just for you personally, but for the people that you care about. They may need that connection with you as well. And really our whole society and culture needs that reconnection. It's a lot harder to badmouth someone that you're looking in their face or sitting in the same room with them. And because we've been hiding behind these masks and separated, there's a lot more of that anonymous bashing going on. And so we encourage you to reconnect. Recenter, get all that negativity out of your life. We've talked about this before. Turn off your social media news feeds that are oftentimes just filling you with angst and anger and all kinds of feelings that don't need to be at the center of your life. Find something you're passionate about. Find something you care about. Find something that brings you joy. Find something that makes you have a smile on your face. And center your life around that. And not so much around the negativity that, a lot of this divisiveness is pushing onto us. And then rebuild. Rebuild after you've recentered your life. Really work on rebuilding those relationships. Rebuilding, parts of your life, not just the physical. We've had, physical losses as well. People have lost homes with the creek fire. People have been impacted economically with COVID. And but not just the physical rebuilding, but the relationship rebuilding and the personal sense of self rebuilding is all really important. And so that's our theme this year for Suicide and Recovery Prevention Month. And I really encourage each of you to take that to heart as you look at your own life and how you can put yourself in a better place. One of the things I talked about yesterday is we don't talk about love a lot. But I really do care about all of you, and I love you, and I want you to be happy. And we need to not be afraid to say that, because when you feel loved, when you feel cared for, when you feel that you have value to the people around you, it's a much better place to be. So don't be afraid to say to the people around you that you care about them. Don't be afraid to ask them if they're okay. And make sure that you're keeping those things in mind as you go through your daily life. All right, on to our questions. So somebody mentioned about the high case rates being in southern states. I'll just say it that way. Definitely we have some parts of the country where there has been bans on mask mandates, really low vaccination rates, and they are experiencing the highest cases of the Delta variant. They are experiencing some of the highest cases of hospitalization and the highest death rates. And so I think what you really can attribute it to is lack of following the precautions and lack of taking advantage of the vaccine. As we've talked about in this space many, many times, people have lots of reasons why they're choosing not to take the vaccine at all or waiting to take the vaccine. And so there's many, many reasons why people do so, and there's some parts of the country where it's much more prevalent that resistance or hesitancy or concern about the vaccine. Any other questions, Brian?
No.
It's a quiet day for questions. All right. I don't have a lot of other things to add, and so without any more questions, I will tell you all to have a good weekend. I hope you enjoyed your holiday weekend last weekend. And that reminder that if you're getting tested at our test sites next week, those will be outdoors. You should plan accordingly. And we will continue to meet with you weekly and let you know what's going on. See you later.